All right, once again, good afternoon. I'm Mark McClellan. I'm the director of the Duke-Margolis Center for Health Policy, and I'd like to welcome you to today's webinar on children and COVID-19 strategies and partnership for vaccination. I'm very pleased to have the opportunity to be here bringing together an outstanding group of leaders in education and public health on one of the very timely and critical public health issues that we're facing as a nation right now on how to protect children from COVID-19 through effective vaccination efforts. And in this effort, I'm also very pleased to have our partners, the National Academy of State Health Policy, Amy Tuerson and her team have been instrumental in putting together this effort with us. Both of our organizations have been working together throughout the pandemic on providing state leaders and other immunization partners the kind of support they need in order to advance vaccination practices, and now with a real focus on pediatric vaccination in medical homes, schools, and other community settings. And we're going to show you some more resources to support these efforts during the course of this webinar. This is still the early weeks of efforts to vaccinate 5 to 11-year-olds, so that we think this is a particularly timely opportunity to share the early experiences that can help advance these efforts as effectively as possible today. And we're looking forward to a conversation, and also want to thank the Commonwealth Fund for their generous support. Now, I wanted to very quickly walk through today's agenda, and this is on the next slide. About what we're planning on covering today. A few introductory comments from me. Then I'll quickly turn things over to Amy Tuerson from NASHB for a quick overview of some of the key policy priorities that state and local public health officials and all those they work with are facing in supporting effective and equitable access to vaccination for children 5 to 11. Then we're going to be joined by Dr. Cameron Webb, Senior Advisor for COVID-19 Equity at the White House as part of the COVID-19 response team for the administration. We'll talk about some of the important activities that they have underway. Then Amy is going to moderate a discussion highlighting innovative strategies for supporting equitable vaccination access. And we encourage you throughout this event to use that Q&A tab at the bottom of the Zoom screen to put in your questions or comments. We'll try to get to as many of those as possible or answer them live. So just a little bit of brief context on COVID-19 in children. We've seen a big Delta surge over the past few months. That has diminished, but just this week, cases overall nationwide are trending back up, with particularly driven by a subset of states that are experiencing, in many cases, very large surges again, probably states that didn't fully experience the Delta wave earlier this year, but definitely an increase in cases and relatively high shares of these cases in younger individuals, including children aged 5 to 11. And while COVID-19 mortality remains very low in this group, fortunately, children are still at significant risk of having hospitalization, having some long-term consequences, and contributing to further transmission in communities involving other higher risk individuals. We now have safe and effective vaccines widely available and authorized for children 5 years and older. So getting to vaccination for this population is very important. So this slide shows some of the key progress in this area. The Pfizer-BioNTech vaccine authorized last month. And as the White House COVID-19 response team announced this morning, an estimated 2.6 million children aged 5 to 11 have already been vaccinated or will be by the end of today. So that's a lot of progress, faster than in older kids, at least initially. So next slide on trends in adolescence. We want to build on the experience there too. Nearly 60% of adolescents have now had at least one COVID-19 vaccine dose, but we are seeing a slowdown in vaccination in that group, with still many remaining unvaccinated. And now let me turn to Amy for an update on priorities in vaccination rate, increasing vaccination in kids.
Thanks, Mark, and good to be here with all of you. I'm the executive director here at NASHB, and really happy to be talking about this topic because I really think it's going to require all of us to work on it together. So just a couple of things. In terms of thinking about where we see challenges, really getting those kids 5 to 11 vaccinated. So, there are challenges for families. There's challenges in terms of access. There's vaccine deserts. There's limited hours of availability. It's an internet-based appointment system, parental work schedules, and lack of transportation, which are all things that, were difficult earlier on in the pandemic and the vaccine rollout, and certainly are true here with this age group. I think a specific piece, though, an additional piece, is the lack of confidence around the vaccine. According to the Kaiser Family Foundation, 1 in 3 parents of 5 to 11-year-old children say they will not get their child vaccinated or will only do so if required. So I do think there's a lot of work there to really address some of the mixed messages that have been put out there around the impact of COVID-19 on children and the need for the vaccine that erodes confidence. I think sometimes inaction is an easier choice when parents are not sure. And there also is, there's been aggressive misinformation campaigns that really kind of undermine vaccination efforts and raise doubts about the need and safety for the vaccines. So really, I think in some of the strategies, it really is going to have to be messaging that really is something that can be done on all levels and that could really ensure that evidence-based messages rise to the top. I think there's also a piece of challenges specific to pediatricians. Pediatricians were not involved, obviously, in the earlier rollout of the vaccine, and they really are needed. With respect to the lack of confidence, parents need to hear from their pediatricians that it is safe for their child to get vaccinated. Not all families have a pediatrician, but those that do, it really will be a valuable piece in the puzzle. And for right now, in terms of challenges for providers, registration for the COVID-19 vaccine is not linked currently to already existing Vaccine for Children program participation. So that's an additional burden and requires duplication of efforts for providers. There's strict reporting requirements for daily inventory and vaccine administration that may disincentivize providers, and there are costs associated with vaccine storage, handling, administration, along with staffing shortages and logistical challenges. So what can we do? And really looking forward to the conversation we're going to have a little bit later with sort of different parts of the puzzle here that can really help us do even better than we're already doing in vaccinating kids. One is really addressing inequities in vaccination rates by race and ethnicity. And I think we've all understood the disparate impact that the COVID-19 pandemic has had on different communities of color and, the different levels of vaccination rates among those communities. And so really making sure that equity is centered in this part of the rollout, I think will be really important to make sure that the vaccine is getting to all where it needs to get to. I talked a little bit already about building vaccine confidence and addressing vaccine misinformation. So I won't spend too much more time on that. Enrolling, training, and incentivizing pediatric vaccine providers, just a couple of things there. Figuring out how to provide training for, places like pharmacies that aren't used to vaccinating the younger kids. Thinking about simplified enrollment to allow for, those folks that are already in the VFC program that may want to be COVID-19 vaccinators. How can we help really figure out how to do that better? And I do think with respect to the incentives, it really is important to think about how we can pay providers differently. There is going to be extra work for pediatricians, for example, to counsel families. And sometimes payment is really contingent on actually administering the vaccine. So thinking about how to break those apart and do those separately to make sure we can get all the pediatricians we can involved in the effort will be helpful. And last but not least, I think facilitating access in a variety of settings. It's not going to just be the pediatricians. It's going to be schools, pharmacies, community health centers. And I think later in the panel, we're going to hear about those perspectives and why all of those are going to be important in this effort and already are. So with that, I think I'll turn it back to Mark. Thanks.
Well, thanks, Amy. It's a lot of great overview of the issues and challenges now, and some of the steps that are being taken to address them. And again, I can't think of any better person to help us think through these and kick off this meeting than Dr. Cameron Webb, Senior Policy Advisor for Equity for the White House COVID-19 response team. And Cameron, you had a chance to hear about those challenges and also the successes so far in vaccination, 2.6 million. That's not a small number in this limited period of time. I would really appreciate your thoughts about how the White House is thinking about these issues and where we can go from here.
Absolutely. Well, first off, just want to say thanks so much for having me today. It's exciting to be with you all. And when we talk about how the White House is thinking about this, what I've been saying frequently over the past couple of weeks is that, I find myself not thinking about this as, Dr. Webb, the internist, or not thinking about this as, senior policy advisor on the COVID response team, but really thinking about this as Avery and Lennox's dad. And this is actually a tweet from our health system just the other week when my kids showed up to get their shots. So Avery is 10, my daughter, and my Lennox 6. And it's so important for us to take a step back and think about, what went into my family's making that decision to get vaccinated. And then subsequently, what went into, our accessing vaccines themselves, And I think that, I'll start off just by describing a little bit about how we approached this, even long before the vaccines were approved, were authorized for use in children. We started that conversation around what could or should this look like. And that included some really thoughtful stakeholder engagement. I think we knew that we would have to look outside of the White House specifically, but also to a lot of the folks on the ground who've been dealing with vaccinations in kids this age for a long time to say, well, what could or should we be doing? And I think we got some great feedback on the front end. One of the first things that we thought about is, where should we be distributing these vaccines? And it was so clear that, we have to make sure that they're everywhere for kids to access, particularly, parents and kids have a cadence of where they're used to getting vaccinated. And so we talked about medical homes, but we also acknowledged inequities in terms of who has a medical home. And then from there, we said, what are some of those other spaces beyond pediatricians' offices, like where my kids got vaccinated, beyond family medicine or MedPeds clinics and where in federally qualified health centers, where else could or should we be going? And school-based clinics became such a prominent piece because we know that was going to play a big role in narrowing some of those access gaps. And that was going to be really important. And also public health departments. And interestingly, I actually just got back from a trip over the last few days. You may have heard that the administration's been doing kind of a bit of a road tour, just going out and talking in different communities about vaccines for children. And what we found, I was in Houston over the weekend on Saturday and Sunday, did two kind of larger fair style events, one with the mayor down in Houston and one with Congresswoman Sheila Jackson Lee. But then on Monday, we went to Little Rock, Arkansas and did an event that was a partnership between the Arkansas Health Department and a community school. And that was a very different feel. And then finally, yesterday in Shelby County in Tennessee, we went to a local public health department was doing vaccinations. This isn't by accident. A big part of our effort here is to check in across the country in some of the places that aren't necessarily all over the news to hear and see how's this going in the first few weeks. And, I'll mention in Shelby County, they talked about how they had one of their big clinic days. They had over 500 kids who were vaccinated, and they were really excited about that. They had that many kids coming to get vaccinated in that first week. And then they noted they've got 92,000 kids in that Memphis area who are between the ages of 5 and 11. And what's it going to take to reach them? And going back to kind of vaccine distribution and the where, I cannot overstate how impressive it was to see in Little Rock, the Arkansas Department of Health partnering with the community school and seeing parents show up in droves to get their kids vaccinated, show up during that school day to sit next to their kids. And there was a young 11-year-old boy who actually convinced his mom to initiate her primary series right then and there when he's getting hit. And so, I think that speaks to one of the second key tenets that we have, which is really that no wrong door notion. And this is something that, our colleagues at AAP and some other places as well have really acknowledged how important this is that family members have to be a part of this vaccination effort. You have to take a family-centric approach. And everywhere you're offering vaccines for kids, understand that it's an opportunity to engage, to educate, and to really capture some of the adults who are still, as of yet, either unvaccinated or may still require boosters. And I think that no wrong door approach is really powerful. I think it creates opportunities for this multi-generational approach. And I think that's really particularly of import in communities of color. But the other thing to keep in mind is these are different formulations. So it's not without its risk. And so with those different formulations, we just, that's one thing we were checking in over the past few days is how has that gone for you? And across the board in all the different locations, folks were saying, it wasn't very problematic. We were able to do it because we knew this was coming, but just important for us to check in on. Just a couple more notes. I heard mentioned vaccine program. And so if you look back at the history of inequities in vaccination rates among kids, you saw how much those gaps were narrowed through VFC over the past 30 plus years. And, acknowledging that became a center point of how we started this effort. But to be clear, not all vaccine for children's providers are participating in this rollout. And there's a reason for that. We've checked in with initially we saw it was around 75% who were signed up and ready to go. And we said, well, who are those 25%? And it was a couple of things. Some were worried about having their resources overwhelmed by planting their flag too early and saying, hey, come get your kids vaccinated here, particularly with, wealthy parents from the suburbs, things that they saw in some other phases of the vaccination effort. But for some, it was the cold chain storage capability. It was more the technical aspects of managing this specific vaccine rollout effort. And so I think it's a clarion call to us, for those providers. How do we help navigate some of those problems? And we found some health departments that are doing creative things to really make sure those providers are accessible, are engaged, because there are parents who specifically look to those providers themselves. I'll just close by saying, public health departments are going to be critical to this effort, making sure that we're supporting them wholeheartedly, working with CDC to get them the resources that they need, partnering them with community. And it all ultimately is going to come down to clear and consistent communication. Because one thing that I found in our engagement over the past few weeks in communities across the country is that a lot of parents are still asking this question of, is this right for my kid? And I think that what they're getting down to is, maybe some of that messaging hasn't dropped all the way down to the street level in various communities. And, we can talk about the 4,500 kids in the trial, the 3,000 who got the shot. We can talk about the fact that, it was very safe, no severe adverse events and, in terms of myocarditis or anaphylaxis. Talk about the other safety profile and also how effective it was. And we can contrast that with the 8,000 kids who've been hospitalized, the 2,000 kids who had MISC, the 800 kids nearly passed away, and in that 5 to 11 range, nearly 200. Right? We can talk about the real statistics, and when you do that, you can make some headway with most parents, but that's not the narrative they're hearing. What they're hearing is, has this had enough time? Has it been tested? Is it going to be safe for my kid? And so that clear and consistent messaging from all levels of government, from all parties involved, is going to be really the key to breaking through to a lot of those parents. And as we know, you can't rush it with parents and with this sort of thing. I think it's about consistency. It's about, showing up, being there, answering those questions, and having a structure that affords that opportunity. And so we're listening to, we're iterating with, and we're engaging with communities all over the country to make sure that as this continues to roll, we do this with, as we say all the time, equity at the center. Because I think specifically with this pediatric vaccination effort, wealthier parents, more affluent parents, parents who are better resourced or more privileged, they're going to get their kids access to these vaccines. It's everybody else. That's who we have to design around. And that's how we've approached it really across the COVID response team. And I think that gives us a chance to really close these gaps.
Cameron, I want to thank you for joining us. We're going to pick up on those themes. You set this up well around no wrong door. We've got perspectives here from public health, from schools, from pediatric and healthcare, and finding some bright spots in this early experience. The points you made about meeting people where they are with accurate data from trusted sources. We'll come back to all of those. I do have one quick final question for you, which is that photo of Avery and Lennox with their vaccination cards. Is that going to be your holiday card this year?
Yeah, I think so. We should just send that around as far as we can. And somebody will say it's photoshopped, but I think that you're right. I think that's one of the ways that we help get the word out. Great idea, Mark.
All right. Great to see you as always. Thanks for all you're doing. With that, Hammy, I'd like to turn to you in our first panel, which I think you just heard a lot of both the challenges and opportunities from Cameron, from Dr. Webb, on how to get these vaccination rates up and do so equitably. And looking forward to hearing more about that.
Thanks, Mark. So I think we are going to I really am pleased to welcome all the folks here to this panel. And I'm just going to do quick introductions, and then we're going to get right to the discussion, because I think there's a lot of good things to talk about here. So we have with us Dr. Brandy Emily. She is a nurse practitioner and health equity branch chief at the Colorado Department of Public Health and Environment. We have Dr. Deborah Greenhouse. She's a pediatrician in Columbia, South Carolina, and an American Academy Pediatrics leader on their Committee for Federal Government Affairs. We have Ms. Alicia Merriweather. She is the Deputy Superintendent for External Partnerships, Enrollment, and Specialty Programming for the Detroit Public Schools Community District. And last but certainly not least, we have Dr. Christian Rommers. He's a specialist in infectious disease and oversees clinical programs in HIV, hepatitis B and C at Family Health Centers at San Diego, which is an urban, underserved, federally qualified health center clinic network. So I want to make sure they can all come on camera now and join me because we're going to have a group discussion on, what are they really experiencing in the context of this rollout for young children. And so I might start with you, Dr. Rommers. As an FQHC, Family Health Centers of San Diego serves uninsured, low-income, and medically underserved populations who may face specific barriers to vaccination. Really curious, what are you seeing as the most significant challenges to getting kids vaccinated, and what steps are you taking to address them at this point?
Sure. Thanks, Amy, for having me. We are right across the border from Mexico, about 9 miles from Tijuana, and serve mostly an underserved and low income, really working population. So the first thing that we've had to contend with is just availability and hours. We started and opened our tents. We have 3 tents across the county that we do vaccination outside of the clinic. And the first day, hardly anybody was there at 9 or 10 a.m. And we wanted to have a big event. And we realized, kids are in school and their parents work 1 job, if not 2 or maybe 3 jobs. So really having flexibility and having people that can access at any time point. But even more than that, I think it was mentioned earlier that a lot of parents still have questions about this. So I've been involved in a town hall that we've really engaged with the school districts and really wanted to get that dialogue going. And it's hard to do an event like that and not feel like we're losing the battle against misinformation, because the questions that were coming through were just directly talking points from anti-vax social media posts and YouTube videos and this type of thing. And when we really drill down to these parents, have you had that discussion with their pediatrician? None of them actually had. Many of them said, well, I can't get in to see them. They're too busy. They're too booked out. And really, those are the conversations that I would encourage people to have, because these are parents who have trusted their pediatrician to do all of the other vaccinations in the child's life, who have been okay with school-based vaccine mandates. In the state of California, you really cannot start kindergarten unless you are vaccinated against the 9 most important infectious diseases. And it really brought to light that just access to medical care and access to those precious conversations with pediatricians was really, really very, very important. So I agree with everything that Dr. Webb has said. No wrong door. We just got some data from San Diego, and I'll just finish with this. In the first week, really, of the rollout here, we've had 25,000 children between age 5 and 11 that have been vaccinated. And it's really all over the place. The county has broken down where they're getting vaccinated. 1,000 or 1,200 of those are in FQHCs, but 5,000 are at the local children's hospital, 3,000 at county sites, and 10,000 at local pharmacies. So it's been really impressive. The no wrong door, just everybody needs to be really on the same page to make this convenient for people. And then also, I can't emphasize enough that conversation with the pediatrician, that trusted source, really crucial to get hesitant parents really over the edge.
Thank you. So many things to follow up on in the rest of this conversation. So given that you ended on pediatricians, I might turn to Dr. Greenhouse. 2 weeks post-authorization, you're a pediatrician in South Carolina. How have the vaccination efforts been going for you for the 5 to 11 population? What feedback have you heard from parents, and have you adapted practices? And what good ideas do we have here to share in this group?
Well, thank you. And thank you so much for asking me to be on this panel. It really is a great honor. So the responses that we have seen have literally run the gamut. They have been all over the place, but I would say mostly positive for us. The initial emotion, I would say, from pediatricians here in Columbia, South Carolina, to some degree was fear, because we didn't know how we could keep up with that initial rush, and we didn't know how long it would take us to get some vaccine. We knew we had a population of families that wanted this vaccine yesterday. We didn't know how many of them there would be. So when the initial approval came, we really relied upon our whole community to help us, because we weren't the first ones to get the vaccine. Our children's hospitals, the health department, our pharmacies got it first, and they really stepped up and they did a stellar job with that initial rush of families that really wanted the vaccine. Well, that rush of families came and went as expected, and the children's hospital and some of those other sites have pulled back on their hours because that initial rush is gone. So now it really has centered more upon us. We got the vaccine shortly after, just a few days after that initial approval. And we quickly started trying to pivot and figure out how, in a very, very busy pediatric practice, could we incorporate this into our daily activities. And we found, again, very quickly, that there were 3 other groups of patients beyond that group that wanted it yesterday. The first group are the ones that absolutely know they want their child to get the vaccine, but they're not going to rush out and get it. They're just going to get it the next time they're in the office. And that's fine. We're trying to reach out to that group and perhaps get them to come in a little bit sooner. Let everyone know who's got a kid that is 5 to 11 years old. Hey, you can call and you can schedule this. You don't need to wait until your child's well visit. So that's the easy group. No real difficulty there. Next group are the folks who are hesitant, but they're willing to engage in the conversation. And this is where I can't agree more with Dr. Webb that we need to meet people where they are. What I have found with that group is that you just start the conversation. And I'll start the conversation the same way that I would with any motivational interviewing conversation. I ask the parent for permission. Is it okay if we talk about this? Is it okay if we talk about any concerns that you may have? The vast majority of folks are going to say yes. And then they're going to bring up a concern. It may be that COVID doesn't affect children. It may be that you'd be microchipped. It may be the fertility question. It may be, I've heard all of these today, by the way. It may be that folks who get the vaccine can shed the vaccine, so we don't want to be around them. We hear all of those every single day. So I'll let the parent tell us whatever their concerns are. And then again, I'll ask permission and say, okay, so I understand these are your concerns. I've read some about these things. Is it okay if I share what I've learned? And very respectfully, I will just share the science as I know it. And we'll have a back and forth. And the parents have been very happy with that. And in some cases, that leads to a vaccine on the same day. Sometimes it doesn't, but hopefully it will lead to continued conversation as we go forward, and they'll go home and they'll process what we said. The last group are the ones who aren't even yet willing to have the conversation. When I ask permission, they basically say, no, I don't want to talk about it. So those are the ones that we're not necessarily going to reach yet, but I say yet because I'm not going to give up on them either. Every family, as we go forward and as we get more and more information about this vaccine, even the ones who won't have the conversation today, may be willing to have that conversation the next time they come in. So I keep trying. I have no intention of stopping with any family. And I would say that it has been very positive for the most part. Just the other day, I had a 9-year-old come in who wanted to celebrate her birthday with us by getting her first vaccine, and she brought us cupcakes. So we had a little birthday party. I had a mom in the office today. Her child got her first vaccine, and the mom started crying. She was so happy that her child got vaccinated. So those are the shining moments, and that's what you live for as a pediatrician. Honestly, that's why we do this. Are there barriers? There absolutely are barriers. Giving this vaccine is more time consuming. There is more administrative hassle factor with this than probably any other vaccine that we give. And unfortunately, that requires staff. It requires space for the 15-minute wait period. It requires a certain amount of storage. All of those things are things that are in short supply in pediatrician offices right now. But we figure it out. We learn, we figure out how to pivot. We have meetings. We figure out what's working, what's not. Here in South Carolina, we get together with other pediatric practices in a learning collaborative, and we share ideas and again, figure out what's working, what's not. And we keep going forward because that's what pediatricians do. And I think every vaccine matters. Every conversation that I have with a family member matters. And we meet them where we are and we keep going.
Thank you. And thank you for sharing all of those anecdotes and personal experiences. It's really good to hear that there's the bright spots and then the challenges, and you're going to keep trucking along. I want to turn now to our other 2 panelists. I might start with just Superintendent Merriweather. So schools. Kids are in school all day. We certainly think schools have a role to play in vaccinating children. Wanted to hear more about Detroit City Public Schools. How has your experience been with your vaccination efforts, and where do you see bright spots and challenges?
Sure. Thank you for letting us speak into this panel. I do think schools play a critical role, just as everyone is speaking. I mean, pediatricians, hospitals, health departments, all of us working together. I think the concept of as many doors as you can get open as possible is the right approach. The school district takes the approach about all immunizations, really, to be honest, that we are a space where immunizations can happen. We've had a partnership with the health department for decades, even for school required immunization. So we did not see COVID as any different. In some ways, we see it as even more important because of the context. But I think most people would agree that schools in general are a trusted location. They are a place that people are familiar with, that they can walk to in most cases. And when you're talking about transportation issues, people in Detroit in particular, people tend to stay in their neighborhoods. They stay in their area of the city. And so if the only vaccination clinic that's being offered is in a completely different part of the city, that already is a barrier. And so making vaccines available at schools, not just because it's a trusted location, but because I can get there is one of the biggest reasons why it matters. I think the other piece that schools can do, which we have done, is really partner with the local health department in terms of offering informational sessions. So coming back to the point that was made earlier about people's questions about misinformation, how do you battle that? We launched something in the spring called Teens for Vaccines, which was an informational campaign. We had teen spokespeople, so students who had made the decision to get vaccinated, served on a panel with a health expert and a school district administrator. And we did presentations together. The hosts were actually the students. And we did specific outreach to athletes and exceptional students, to parents, et cetera. And it was very well received. I think the point about saturation of, there's the early adopters, and there's the next group Dr. Greenhouse talked about, and then there's the last group. And so as we're, kind of ramping up with the 5 to 11-year-olds, we're starting this whole campaign again and really thinking through what did we learn from the first time around that worked, and what maybe could we revise differently for the 5 to 11, but also understanding the 5 to 11 is a little different. It's a little different group. People who teach elementary school are a little different than people that teach secondary. And there's differences there about approaches that we use. So we're trying to really think about that. I am excited to share that we had our first district-wide vaccine clinic on this past Saturday. We did have 300 people come through. About 150 of them were young people. And then the other 50 were adults, either getting their boosters or their first shots. And we wanted to be sure that if we're opening the doors, that whoever comes through, if they want to get vaccinated, they can get vaccinated. And so the health department worked with us, and we had a really good event. When you look at the fact that we have like 25,000 kids in the age bracket of 5 to 11, 250 is not anything but a drop in the bucket. But I think someone mentioned earlier, every vaccine matters. So the fact, I told, on Saturday, I said, I don't know who's coming because we really don't understand what the market is right now. To use is probably not the best word, but in terms of how many parents are ready, we didn't know. You know what people say, but until they actually do it, you don't know if they're actually going to show up. And I told everyone, I said, if just one person gets vaccinated today, I'm going to call it a success. We're going to have to do lessons learned and figure out how to reach more people. But every vaccine that goes out is a success. It's the whole starfish story that, you saved one, it mattered to that one. And so if other people have ideas out there, we're certainly open. But our health department has been an incredible partner. We could not do this as a school system without the health department. And I think the health department would say they really can't do this without the schools working together. And so we're lining up a bunch more clinics in the next month that strategically will be in every single one of our neighborhood feeder patterns. So every neighborhood high school has K-8s that feed into that high school, and we will strategically have at least one clinic in every single feeder pattern across the district. And we'll be doing that with the health department and other partners.
Great, thank you, and hope you get a lot more kids through your clinics and feel like every vaccine does matter, which it absolutely does. So certainly, last but not least, I wanted to turn to Dr. Emily. So really interested in hearing the state role. And we talked a little bit in before you all came on as panelists about sort of the need to focus equity. And we heard about Dr. Webb, building an equity and, the outset of this rollout. Really wanted to hear more about what you're experiencing in Colorado and how you're thinking about centering equity in your efforts and what lessons you've learned sort of along the way in the vaccine distribution process.
Yeah, in the state of Colorado, we really have put equity at the forefront of our vaccine outreach. We have gone as far as to build a whole branch and build a team of outreach coordinators who are in the community. They are on the ground. They are working with local partners, our local public health agencies. They're working with the school districts and anyone who's interested to help educate, to provide resources. And it really oftentimes comes down to access. And we want to make sure that we are meeting people where they are and offering opportunities for vaccination anywhere we can. One of our big endeavors in the state of Colorado has been our mobile vaccination units. These are buses that provide vaccine. We started with 4, and they've been so successful that we've expanded to 15. They really are all around the state offering vaccine in places that don't have vaccine otherwise. Some of our vaccine deserts in our rural counties, after hours, weekends, and locations where we know communities of color are, where we know that our essential workers are, who can't take time off, who don't have the opportunity to make appointments. And so we want to ensure that they have walk-up available and that we are where they are when they get off work at 7:00 at night. We've got a bus available in shopping centers and places, places of work. We've worked with lots of employers to offer them as well. And so as we expanded to kids, we kept the same approach. And so a lot of our big school districts have school-based clinics available to them. We have partnered with them in many ways to ensure that they have vaccine and they have the support they need, but also ensuring that our regional coordinators are working with those smaller community school districts that don't have the same resources and access to providers. And so we send our buses there and we partner with them to make sure that we are vaccinating children as they are interested. In some of our rural counties where there's more hesitancy, we are, working with them to identify places that are acceptable to families who are interested, but, taking away that barrier that some school districts feel where they don't want to be placed in the middle of some of the dynamics there. So, our mobile vaccination units have vaccinated over 10,000 kids already across the state of Colorado. People are very receptive. They are excited to see them in their communities. And so we're excited to continue to partner with them. Another incentive or initiative that has been very helpful has been our Champions for Vaccine Equity. This program was established before we had vaccine in the state. We knew that people had questions. We knew it was coming. We wanted to get ahead and really understand what communities knew about the vaccine and what their questions were and where their hesitations were. And so we worked with community or providers of color. These are Black and Brown providers that are trusted in their communities and who have shared lived experiences and speak the same language. So we have been able to partner with community-based organizations and religious institutions and schools to provide webinars, listening sessions, never with the intention of convincing anyone to get vaccinated, but really just to be there to listen to what their concerns are, to understand why they are hesitant, and answer questions and provide, that counter to the misinformation and disinformation that exists. And so we continue to use our champions. They are wildly popular in the state and continue to be a great resource for our students.
Thank you for sharing that. And, really, really good to hear sort of the innovations and the ideas that have been born out in the context of this pandemic. I did want to make sure to remind all of those in the audience to please just go ahead and chat your questions in the Q&A if you have them. We will have some time in a couple of minutes if we have questions to have the panelists answer them. But in the meantime, I did have a question for the entire panel. So I think there's so many things we could talk about in the that until 5:30. We certainly heard about the bright spots and, of course, the challenges with misinformation and the need to have access to trusted physician or other trusted resources. I did want to ask specifically, are there different kinds of support that you all feel could be useful from states to federal government or other private partners that could help you in your efforts to increase vaccinations for children? Something specific that comes to mind that we haven't talked about or that you wanted to raise for the group? I don't know who wants to go first on that. Dr. Rommers, are you coming off mute?
Sure. Yeah, I can start. I think I sit on the County of San Diego COVID-19 vaccine advisory group. And one strategy that we've really used, and it's been quite effective, is just adding support for the town hall format. People really don't necessarily want to dial into a webinar with a bunch of folks that they don't know. But if you have someone with expertise who can answer questions, come into a school and do a PTA-focused town hall, that is very powerful. And we've done that a couple of times with local media partners serving as moderators, where it really feels like a PTA meeting, and it's parents getting their own questions answered. The format that we used was allowing them to submit either written or video questions beforehand. So you're really responding to a lot of the myths that are out there and a lot of the concerns. And it really, I think is very effective. We heard feedback that people actually changed their minds literally because of that, just 1.5 hours doing the town hall. So as much as local health departments and then any federal or other policy resources can help those intimate conversations, again, because some people said, well, I haven't been able to get to my pediatrician to have those questions answered. That I think is very effective.
Yeah, no, thank you for raising that. And I think the science also tells us for some families, they don't have a pediatrician that they go to regularly, and we're going to have providing other resources for them to get this information. So I think that's a great point. Others on the panel want to chime in on this? What could be useful?
Sure, I'll jump in. One of the things that was very helpful in our first round of vaccines were some nonprofits and other, I think there were organizations that had received grant funding to support vaccination clinic outreach, and then just like swag bags for when the kids were leaving. It sounds very minute, but just a little bag with a bottle of water, some reminders about how to stay healthy during COVID, something fun. When you're dealing with peds, I think it's a little more important that they have something that they take away in addition to the vaccine. And for the school district, those are not things that we're necessarily able to purchase. But I think they're important when you're doing pediatric young people outreach is how do we think about making the whole experience a little lighter, a little more engaging. We did have a group on the first round of vaccines that did a whole interactive piece also when people were coming out from getting their vaccination, where they could write down why they got vaccinated, and they took a picture with it and sent it to the family, and they posted it and they tweeted it. But that was all a whole nother work stream, if you will, in addition to hosting the clinic. And so those types of what seem to be little things, but I really do think they make a big difference. That type of support, I think, can be very helpful. And I would piggyback on what was just said in terms of having medical experts who their whole purpose is to be available to join town halls, to join meetings where it's not a struggle to schedule something. This is all they do, and they're happy to do it, and they're very well trained at how to answer the very tricky questions. I think having a cadre of people that are accessible with Teams and Zoom. One of the side effects of the pandemic is that we have moved into a digital age that was already here, but is exploded. And so it's almost, if there were a cadre available nationally that you could pull on, I've got this event, you still want to have local voice and local context, if you will. But if there were some sort of cadre you could pull on, so it's very easy for someone to join a meeting like this from across the country like we are today.
No, that's a really great point. We've all learned how to use Zoom in a lot of different ways. And so thank you for raising that. We do have a question, and I'm going to just turn to a few questions that have been chatted into us. This is one for Dr. Greenhouse. So the question is, I talked with my PCP about how to keep the conversation going with patients who are very resistant to even talking about COVID vaccines. I suggested letting the patient assume the mantle of authority by saying something like, "That's fine. Can you help me for when I talk to other patients who may have similar feelings to yours and tell me more about what you're thinking or feeling about COVID and vaccines?" That won't turn them into wanting the vaccine, but could keep the conversation going. Any thoughts about that approach with those who are very resistant?
I think that approach is perfectly fine. I think a lot of the families that I have worked with who fall into that last category of being very resistant honestly will shut down even that aspect of the conversation. I haven't really found them willing to even go into it that much. So what I have chosen to do in that scenario is simply to ask them to continue to keep their eyes open, to make sure that the sources that they are using are legitimate sources with real data. And I will steer people away from sources that I know are very commonly used in this area and are just misinformation or even worse, disinformation. But I think it's a perfectly fine approach if it works, but I'm not quite sure how often I would expect that it would work.
Yeah. Thank you for sharing. We have another question I open up to anyone on the panel who might be interested in responding. So how are you engaging with pediatricians that trust all other vaccines except for the COVID-19 vaccine? How can we convince them that this is safe and effective so that they can pass this information on to the parents and guardians of the children they serve? Dr. Rommers, go ahead.
Yeah, I think there's a couple of different angles you can take. I mean, doctors are victim to the misinformation, unfortunately, in some ways, just like everyone else, depending on what news channel they turn on when they go home at night. But we would hope that, given their medical training, that they would be able to interpret data and be able to sort of sympathize with what's going on with kids. And as Dr. Webb actually mentioned, just go through the number of hospitalizations and deaths and episodes of MIS-C that have happened. And then I like to compare it to other things that they already do. You know, when you line up flu deaths in kids compared to COVID deaths, COVID wins. When you line up flu hospitalizations next to COVID hospitalizations, the MMWR report recently, you know, COVID leads to higher length of stay and more likelihood to be in the ICU. And then we have MIS-C. So if they're making objective decisions based on things, they really should be swayable that way. Or you can take the tack like, well, you know, you're a pediatrician, you probably are a member of the AAP. What does your professional society say about this? And we've had success with that with our OBGYNs that were actually resistant and hesitant to recommend vaccines to pregnant women. When ACOG, or the American College of OBGYN, came out strongly and suggested vaccination of pregnant women, we said, well, why don't you follow your own professional society's advice? And thankfully, the professional society had a very nice resource on their website about answering questions there. So I think those couple of approaches work. I'll be honest, there's folks out there practicing medicine in private practice with their own shingle that don't want to hear about it. And they're going to have their own views. And maybe that's not going to be a high vaccinating practice. And that's okay. Maybe their patients can go to a pharmacy.
Yeah, no, thank you for that. Anyone else want to chime in on that? We have a couple other questions that have come in. I'll go to the next one if not. Okay, so this is a little bit of a harder one. How do we convince schools to host COVID-19 vaccine clinics in very political towns? Anyone want to respond to that one? Dr. Green?
Yeah, just to say one word on that, because I'm in South Carolina. It's a pretty heavily politicized, very conservative area. For the most part, our public schools for the younger kids have not really started doing any vaccination clinics. But I don't know that that's because they don't want to. I think in a lot of cases, it's because they simply don't have the staff to. So if our health department were to try to partner with them, I think it might become more of a possibility. I think it would still be a really tough sell in this area. I think a lot of parents, the same folks that are showing up at board meetings, harassing pediatricians who have been advocating for masks in schools and advocating for vaccines, those same folks, I believe, would raise just as much cane over vaccine clinics in the schools. That said, we have had some charter schools that have partnered with private pharmaceutical companies and have done vaccination clinics in the schools for the younger kids, and they have gone wonderfully. So I think we have proven both that it can be done here and that it's difficult to do here and be able to ramp it up without a ton of politicization. And I think that pretty much sums up a lot of the problems around COVID vaccine in a nutshell. It's simply been politicized, and no vaccine should ever be politicized.
Yeah, no,
There too. We did a town hall in an area of Eastern County, San Diego, which is quite conservative as well. And I think it really helped as a way to just take the temperature down a little bit, because the constituency was charged up about mandates, and there's been demonstrations and people pulling their kids out of school and everything. And early on in the town hall, it was the superintendent was really one of the facilitators, and he said, "Look, none of your 5 to 11-year-olds will be mandated at all this year until full FDA approval." And that's the California vaccine mandate is basically written into that executive order that it has to be full FDA approved. And that really took things down a notch. And then it's like, okay, now let's talk about whether you want to get this or not. And the parents that were there with pitchforks and torches ready to go at us is the closest I've been to a school board meeting. That really, it calmed things down, and we were able to actually talk about myocarditis and actually talk about COVID in kids. And so I think the plan actually is to go back into that same district with vaccination clinics now that we've had the initial conversation. So maybe sequencing things, getting the questions answered first, and then following would be a good strategy.
That's great. And Dr. Emily, did you want to chime in? Yeah, go ahead.
Yeah, I was just going to say, we were very intentional in Colorado about making outreach to every public school district to ensure that we were offering our support and services for those that just didn't want to touch it for political reasons or whatever that may be. We were able to offer creative solutions. Maybe the street next or the park next door, or, something very close. And we were able to partner with schools in that they would send out information to their parents so that, they were not the host. It wasn't on their property, but, just to let people know, make them aware that it was available. We also partnered with, we reached out to over 100 different large event partners around the state. So our zoos, our libraries, our community rec centers, our museums, every part of the state in order to offer fun locations where kids could get vaccinated. And so every county has a location where the schools can let their students know and their families know that vaccine is available at these locations and offer that to their parents, and they don't have to bear that burden themselves. And so that's been hugely successful. We've already had over 50 different partners at these large events that have been willing to work with us, sports teams, zoos, museums, and they've been a great resource to the communities, and the communities have been very appreciative to have those resources available to them.
Can I ask just a follow-up question on that? So for the schools that were maybe resistant in actually hosting the clinics themselves, just to confirm, but if you did it, at a nearby park or a zoo, the schools were willing to send out the communication materials to parents to say, here's where you can actually go, and here's, why it could be helpful. Was that what happened?
I would not say 100% of them were, but definitely there were more that were willing to at least do that. In order to, just provide the resource, to their families.
Okay, thank you. Great. And so in the last couple minutes, I just wanted to ask one follow-up question for you all. So, we've heard a little tidbits about how children can play a role in this. And, I really loved hearing about Dr. Greenhouse, how you got the cupcake from one of your patients. And, I'm sure that made your day. What do we think about the role of children? And that we could talk about the adolescents too, because I certainly saw for my own daughter who's 14, the day the vaccine was authorized, she was sending me texts before I had even seen the news that she was getting herself signed up with all her friends. And I was like, okay, you go do that. So really curious about what you think the role for whether the younger children or the adolescents can play in sort of this next round of trying to get people vaccinated. I don't know who wants to start with that.
I would love to start with that. because I've seen it and I continue to see it every day. The kids get it. The incentives and the prizes and all that at the vaccine sites are great, and we give out prizes too. Of course, we're pediatricians, but that's not the issue for the kids. The brass ring on the carousel for the kids is getting back to normal. It's the idea of going to school, of being with their friends, of not worrying about getting quarantined every other week, of being able to play on their sports teams, going to the movies, going for a sleepover. It's getting back to normal, and the kids get that. Even the little ones get it. So if you ask them, they're going to tell you, I want to get back to normal. And if getting this vaccine is what it takes to do that, that's what the kids want. And that was the case with the 12 to 17-year-olds. It is the case with the 5 to 11-year-olds. It's the case with this kid who brought us her cupcakes. She was so happy that she's going to have the opportunity now to get back to some sense of normal. So the kids will get us out of this. The kids aren't politicized until somebody politicizes them. It's just like they said, no child is born racist. A child will play with anyone until someone tells them not to. It's the same thing with this. The children see this as their way out. They don't politicize anything. They get it. And we need to take advantage of that. And frequently I will do exactly that. And I'll turn to the parent after a child tells me that they want the vaccine when the parent is hesitant. And that's happened a bunch of times to me. And I'll turn to the parent and say, hey, let's listen to what he has to say and why he's saying it. Those almost always turn into vaccination visits.
I couldn't agree more. I think it's a powerful message. Of course, you have to be careful with putting kids on TV without parental permission and stuff like that. But using people that have just gotten vaccinated to convince those that are hesitant is incredibly powerful. We've heard stories of hesitant parents and grandparents get the vaccine on the spot when a 5-year-old little hero pulls his arm up with the Band-Aid on there. In our local region, African Americans were hesitant at the very beginning quite a bit. And what they asked for from one of the local nonprofits was, I don't see any pictures of Black people getting their vaccine. And so they started a campaign putting out videos and pictures and billboards of lots of people with Black and brown skin getting their vaccinations. And it really helped. So I think there's that contagiousness, infectiousness of the positivity of getting the vaccine. That's really, really important. And I wish this would happen more, that, we've seen 5 and 6-year-olds go get their vaccine and their parent, who's a firefighter, who's caught up in this really political resistance to getting vaccinated and fighting against mandates, on the spot chooses to get it because of the 5-year-old son or daughter. So I think we should use it.
Yeah, no, what a great note to end on. And I just have to say thank you to all of you for sharing your insights. We're at our end of our time today. We do have just 2 resources to highlight for you. NASHP has put out a paper on vaccines in children, and Duke-Margolis has a set of resources for vaccines in school settings. But what a fantastic discussion. Thank you to each and every one of you for participating and for your efforts in this. Your passion clearly came through in the discussion. And I also wanted to just thank Dr. Webb, and of course, on behalf of Mark McClellan, the Duke-Margolis Center, as well as NASHP, thank you for all of you for joining us today, and a special thank you to the Commonwealth Fund for their support of this project. We will be sending out the slides, and for those of you that didn't join live, there'll be a recording as well. So thank you all, and I hope we all continue to work together on this and get more kids vaccinated. So take care, everybody.